unfortunately, sometimes people are not picked up. And it just as we've said, so the American Academy of Pediatrics and the National Heart, Lung, Blood Institute, which is the NIH, recommend that children with a family history of cardiovascular disease or a family history of familial hypercholesterolemia be screened with a lipid profile at the age of 2. And that would be enough. If you screen with a simple, very inexpensive cholesterol profile at age 2, we could make the diagnosis. The American Academy of Pediatrics and the National Heart, Lung, Blood Institute also recommends universal screening between the ages of 9 and 11. That means every child should be screened. So even if you don't know enough about a child's family history, we have some fractured families and you might not know, or a family may have parents with heterozygous FH who are being treated with a statin and they don't realize they both have it and could give it to a child. So universal screening is crucial, and it's not happening. Only between about 5 and, at the best situation, 20% of kids are screened between the ages of 9 and 11 with a lipid profile, which would give us the diagnosis of HoFH. It would certainly push us on the way. And so why aren't kids being screened? Part of it is that sometimes pediatricians don't know the guidelines, but one of the most important reasons kids aren't screened is there's another body in this country called the US Preventive Service Taskforce, and they have issued they weigh in on pediatric screening, and they say there's insufficient evidence to recommend screening. But in that document, they also say HoFH is out of scope. And we ask at the Family Heart Foundation, how can HoFH be out of scope? It is the most serious form and it is being missed. And we sent a letter to the US Preventive Service Taskforce signed by the American Heart Association, the National Lipid Association, many families with early cardiovascular disease with HoFH, asking them to reconsider. And we're very hopeful that that will happen. But the journey is that if screening happens and if we're lucky, we find out early. And the minute you find out, children should be screened, and then they should be treated with lipid-lowering agents. So even kids as early as 2 can be on statins, can be on ezetimibe, can be on PCSK9. Well, PCSK9 inhibitors would be off-label, but because it's such a dire diagnosis, we throw the book at it. And then there are 2 medications that are solely for HoFH. One is called lamidipide, and that can be used. It's an oral agent starting at 18, and another is evinuncumab, and that has just been approved. It's an injectable or an infusion that has just been approved for children 5 and up. So if the kids can get started on those medicines, we now can get children with HoFH, we can get their lipids under control. Same is true for adults. Many adults are not diagnosed until they've had a cardiac event. In our study, the eldest person who had genetically confirmed homozygous familial hypercholesterolemia was 37, diagnosed at 37 at the time of a cardiac event. So we don't want to wait to someone to have a cardiac event to make the diagnosis.